for the trainers, especially because I know very well, because I follow this issue of quackery. In fact, some years back, I wrote a lot of articles. I think we have some of them flying around. And at a particular time, I just want to share this my little story and see how deeply and as in how terrible the situation is. Now, I wrote an article about this. I think it was the government of Ogun State then. I've forgotten the year, maybe 20. The then chairman, the NAM, I mean the state's NAM chairman, they clamped down on some private hospitals that were involved in all this illegal training. And I wrote an article just to say this is what we need to do. We should keep more effort and things like that. Can you imagine? Some weeks after, one particular doctor, I think I can still remember the name, one Dr. Paul Iki or something like that, one Dr. Paul from Port Harcourt replied to my article. It was, in fact, he went to the extent of abusing me to that extent for you to know how terrible this situation is. And at the end of the day, he was quoting some of the articles from Medical and Dental Council of Nigeria law, saying that they have the right, things like that, to train people in things when there is need or something like that. And that is why I'm now asking this particular question. Now, some of them are hiding behind this particular thing, this particular article in the Medical and Dental Council of Nigeria. It means there will be no way, there is no light at the end of the tunnel about this particular issue. If there is no law that is going to deal with people that are training the trainers. Now we are talking about the trainers, fine. We are working on that. What about we are talking on the training, fine. What about the trainers? Is there anything to clamp down on the trainers that can be used in the court of law against the trainers, whether a medical doctor, a nurse, or any other person? I think I lost my guest. It's quite actually an interesting topic, and I think it's something we cannot even finish within 1 hour or 30 minutes or whatever. It's a long topic, and I think it is quite very, very unfortunate that we find ourselves at this stage in the Nigerian healthcare system, most especially in nursing profession. I think this is high time the government should take a bold step in stopping this thing once and for all. It should be dealt with once and for all. We cannot continue this way. And that is why we have high mortality rates, talking about infant mortality rate, talking about pregnant women, talking about children. Look at the health indices. Look at the classifications about the healthcare systems around the world. See where Nigeria belongs to. It's an index showing that something is wrong. Yet, we can boast of professionals that they work diligently, talking about doctors, talking about nurses, talking about medical lab, talking about pharmacists. We are talking about all of them. These are people that are already, that have the skills, but the system is so corrupt.
Yeah.
Thank you for coming up on the show. I can't wait.
Sorry for the breakup.
No problem.
Good. Now, as I was saying, we are not against anybody training anybody in their facility or in their business premises. But when you are training this person, why are you training this person and name to a particular noble profession? They can train even somebody that can sweep in their premises, business premises. They can still train somebody that can drive a car in their business premises. But in the sense that this something, okay, why are they not training somebody and call that person an auxiliary surgeon? Why? Because they know that this is very critical. Why are they not training somebody and call auxiliary doctors? Because they know that it's very critical. Then Why are you thinking that nursing profession is the only profession that you have to train somebody and name after? And this is a profession that you know the services that they are rendering to the patient. And this person, the people that are in this profession, spend 24 hours with this patient. And by the time you allow the wrong people to have access to this patient in 24 hours, what do you think the mentality of our people will be? No matter the fact that you have a doctor in that clinic, because a doctor spends few hours with a patient, and a nurse that is giving you the nursing services in that clinic spend 24 hours with that patient. Do you really think that you can have a good mentality? You, you cannot have. That is why you see the public trying to have a negative perception toward nursing profession and toward nurses. Because the wrong people are the ones that have been exposed to them 24 hours. And this is not really helping our own profession. We have also the capacity, we have also a kind of an article where we have to train people. But you will never see us doing that and train these people and call them auxiliary doctors. You will not see us doing that, because we understand what medical profession is all about, and we understand what other health profession is all about. So we are not just like trying to fight over this. We know that the manpower is actually, we are having shortage in everywhere. But when you are training somebody, train that person. Either you call that person a medical assistant or health assistant. Don't call that person an auxiliary nurse, because we do not have it.
Thank you. Thank
That
you
is
for
why
that
the
detail.
Nursing and Midwifery Council have to put their head together and come up with something we call licensed community nurse. And they are already started flagging up in many states, because we want to wipe up these things, so that don't complain that we don't have manpower. This program is going to be just 2 years. So this is something that all of us should join hands together, or else we will continue to allow to have more deaths in the health sector. Let me shock you something. There is just a motion that one house member in Akwa Ibom State House of Assembly developed so much passion on it, and that was on Quackery. And that house member actually presented this motion on the floor of the house. On the conclusion of that motion, it was one of the motions that I personally picked some people at the nursing ambassadors and other professions. We wrote up a motion and sent to him. And after reading, he now called on government that government should partner with this professional body. In nursing, we have a professional body that takes care of this aspect, and it's called the Nursing and Midwifery Council, in collaboration with the National Association of Nigerian Nurses and Midwives. And in Nursing Council, we have a sector, we have a department that takes care of this quackery. So once we discover that you are training people and you are calling them nurses, we will bring these people in and they will shut down that hospital. Because you do not mean well for the good people of Akwa Ibom State, and you do not mean well for the good people of Nigeria. Thank you, my brother.
Thank you very much. That will take me to this particular question. I think you are doing a great job. I mean, the nursing ambassador of Nigeria is doing a great job. We should commend you guys for this particular wonderful bold step that you are taking. And I think is something that should be emulated by other states, even to the federal level as well. I think it's quite commendable. There's no doubt about that. But considering the fact that in Nigeria, so many things goes wrong. When people want to fight the corrupt individuals, we have there is this particular thing they say: when you are fighting corruption, corruption will fight you back. How secured is your life and your organization as well? Because I want to believe that definitely there are some big powers behind this quackery training. Definitely, we cannot rule that one out. I'm still waiting for I think my guest house connection issue. I'm just saying it so I don't have the fact with me. So let me just I don't have the fact with me, but I want to believe because we've heard it so many times that when you are fighting corruption we fight you by because all this thing that is happening by training quackery in all these healthcare sectors. As for me personally, I'll see it as corruption. So definitely when some guys or people are coming together and they are trying to talk and see telling the world, telling the government, telling the citizen, telling the people that you have to do the right thing. And definitely we have some people that will say, no, this is where we are eating from. This is where we are gaining our own momentum or we are gaining our riches or whatever they are getting. And you want to come and cut it off, then we are not going to allow that. That is corruption, and we know definitely they want to fight back. So, and it's again, I think it is something that every meaningful nursing organizations and even I think this thing should go beyond nursing. Seeing it as a nursing problem, this should be seen as a global healthcare problem in Nigeria. I will repeat it again. At what level, based on global index, does Nigerian healthcare system belongs to? We can see it. Despite the fact that we have these huge resources, we have human. We have it all. Are we talking about the consultant? Are we talking about specialists? Are we talking about nurses? Are we talking about medical lab scientists? Are we talking about pharmacists? We have good hands that can take care of this healthcare system in Nigeria. So why are we now rubbishing our own healthcare system by supporting all this quackery training? It is uncalled for and it's very, very bad. The lives of of everybody in danger. That is just the meaning. I'm getting a message from my guest. I think he's unable to reconnect back. Come on, I think connection should should allow him to come in. And I hope it is not those people that are causing him not. Causing the connection to be bad. No, whether you like it or not, my guest will still. You still come back. We are going to end the show. Anyways, we are almost at the end of our show. I just have one or two questions before we end the show, but I don't know. I think we still wait for some seconds to see if my guest can reconnect. But it's quite an interesting topic. I'm still going to talk more about quackery in nursing profession, in healthcare system in Nigeria, with in my subsequent video. So we are still going to talk about that, and for my own findings too, we are still going to talk about it. And don't worry, it is a topic that we cannot finish in a day. So it is an ongoing discussion, and it involves the society. It involves it involves everybody, because it's about life. My guest has said it. If you are talking about quackery in other aspect, there is no problem. If you are talking about something in other aspect, there is no problem. But we are talking about lives. You should value lives. Any little error committed by a practitioner that we refer to as auxiliary nursing, which does not even exist in the first place, it means all these people that are even calling themselves auxiliary nursing, they are even illegal, because this particular title does not exist in neither Nursing and Medical Council Act, nor Medical and Dental Council Act, nor any other, not even our general constitution. It doesn't exist anywhere. So where is the title coming from? So we are allowing people to rubbish. Our healthcare sector, even with that, because before anybody can have this particular title, even after going a lot of training, even from the so-called private hospitals, were they authorized? Was there any authorization? I don't know of any other one. I don't know if there is in the Medical and Dental Council of Nigeria, if it exists medical assistants or auxiliary medicals. I don't know. In pharmacy, I don't know, just like my guest has also rightly said, we don't know whether it exists in in the act that set it up. In fact, he said it boldly that it doesn't even exist. But for sure, we know in nursing, there is no other title. There is nothing in nursing title as auxiliary nursing. It doesn't exist. It's either you are a general nurse, which is RN, or you have other specialty. psychiatric nurse, or mental health nurse, midwife, public health nurse, accident and emergency nurses. We have all those are specialties. But the title auxiliary nurses, it doesn't exist. Let me see if my guest can still come back and join us before we end the show. And to thank everybody that comes on the show today. Thank you. I was saying I don't know if it is these big guys, big men that are behind the network connection today. Whether they like it or not, we are going to end this show. Still having problem with the connections. Oh, I think my guest is still having problem with the connection, and I don't. Let me thank everyone that joined us today for this particular event, and even people that joined initially on the first video that we started with before. We reconnected back this particular one that is ongoing. Thank you very much for coming up on the show. Thank you for joining us. It's been a wonderful time with you guys and with your support for this particular event. This particular event was not to, to talk down on some group of individuals or whatever, just like my guest rightly said it. But we are trying to see that we need to work hands in hands. We need to work together. We need to do things together to resolve this menace once and for all. Now, back to my guest. Just the question I asked before we end the show. I said, we know very well that people that are enjoying from this particular quackery training, they will not be happy with your actions and your events on trying to stop from their eating. So how secured is your life and your members?
Okay, thank you, Mr. Adam, for that question. You know, we are very safe because you are there, and we are very safe because we are trying to save the citizens, and we are very safe because we are also working in collaboration with the government. We are also promoting their plan, because like what the government just said last time in Akwa Ibom, that you are going to renew, and we have to sanitize our people and sanitize the good people of Akwa Ibom State to ensure that by the time you go to the clinic, get to any private clinic, ask that person that is giving you the services, are you truly a nurse? What is your specialty? Where were you trained? Let the person explain the condition that you are having to you. Let the person explain the drugs he's giving to you. Let the person explain all the procedure that is given to you. Because as a citizen, you have the right. That is why the Federal Republic of Nigeria came up with that patient bill of rights last time. So a patient, you don't just go to a hospital and take drugs. So that you will not take poison. Ask questions. What is wrong with you? You have that right to know what they are doing on your body. And you have the right to choose who is going to do anything on your body. And that is why the government has been given that mandate to take care of and secure, maybe protect life and property. So as a profession and as a professional organization, we are very safe because we know that we are trying to save the public and we are trying to promote the agenda of the government.
Thank you. Thank you.
We are not witch-hunting anybody.
Thank you very much for that. Now, before we end the show, your final words. I know you are a regular friend of the show, so definitely final words never final. It's never final. So, but for this particular event, your final word, please.
Let me use this opportunity to thank Adam's Health Blog. Let me appreciate the nursing ambassadors of Nigeria. Let me appreciate Nursing and Midwifery Council of Nigeria. Let me appreciate National Association of Nigerian Nurses and Midwives. Let me appreciate all our professional bodies, both the NMA, the Pharmaceutical Society of Nigeria, the Association in Medical Lab Sciences, because as we want to have that teamwork to ensure that we wipe out the menace in the sector. Are good people. Also appreciate the government of Akwa Ibom State, government of Nigeria, and all the good citizens of Akwa Ibom, Nigeria. Oh, my good organization, cable newspaper. I can't forget them. They have done a wonderful job. We'll keep on to educate the public about Quackery, and we will see what we can do to partner with the government and whosoever that is willing. We are also open to a point of saying if any private clinic need a nurse, contact Nursing Ambassadors of Nigeria. We are going to provide, even though you need a nurse, 100 nurses on different specialty, we are available to make it available for you.
Thank you very much.
So that you will not go in and be training quacks.
Thank you very much.
And use them to kill our people.
Thank you very much. I love this particular aspect. With the collaboration with other healthcare professionals, medical council, pharmaceutical council, medical lab, and all others. Thank you very, very much, Ambassador David Onoite. He is actually the publicity secretary of Nursing Ambassador of Nigeria, also a co-founder of this particular organization. Thank you very much for coming up on the show, and thank you for spending your time with us. And I hope when next time we invite you again on the show, you will answer our invitation.
Thank you.
Thank you very much. And to my viewers from wherever you are watching around the world, thank you for staying with us. Thank you for spending your time with us. Thank you for using your data to be with us, because this is just a particular support that I have. I just inform you guys. Thank you very much for coming up on the show. And for those of you that you are not with us right now for one reason or the other, don't worry. You will still have access to this video on the YouTube channel. Everything will be there. You can still watch and see this. How wonderful this particular organization is doing, how wonderful the publicity secretary is doing, and you can see how wonderful they are doing in Akwa Ibom State. And I want to challenge every other state to kindly take this bold step. If you have done it before, let me invite you on Adam's Said blog, and let's see and share your experiences as it's been done by my current guest on the show today. Thank you very much. And don't forget, COVID-19 is real and is still in existence and is spreading like fire. And despite the fact that we have the vaccine, is getting, terrible and terrible and terrible every day. Now we now have a new variant, we now have new mutant and things like that. So please keep safe. The best of it all is wash your hands regularly, use your face mask, and keep ensure the social distancing. You don't know who the next person, because it's not written on the face whether the person is positive or not. Have a blessed day, have a blessed night, have a blessed weekend, and I wish you all a fruitful week ahead. God bless you all. Bye.